Doctors, today we are going to discuss about another topic from the Beckman's and Ling Gynecology book. That is, we are going to discuss placenta previa. So, what does placenta previa mean? So, what this book say about this? So, placenta previa is a placental location close or to or over the internal or cervical os and is associated with an increase in the preterm birth and prenatal mortality and morbidity. It can be classified as complete, in which the placenta completely covers the internal os, or partial, in which the placenta overlies part but not all of the internal os. A placental edge within 2 cm of the internal os without covering it, it is called as marginal preva, while a placenta that extends into the lower uterine segment but in more than 2 cm from the os is called as low-lying placenta. So, what do you understand about the placenta previa? So, placenta previa is a condition in which the placenta, which should be normally present near the fundal region of the uh, uterus, instead present at the normal position, it come down and completely, sometime it completely present to the internal os, or sometimes partially. So in the first image we can see that the placenta, that the red area, it is completely covering the cervical internal os. So this condition what we call is a complete placenta previa. But in this condition, you know what, only the partial, only very less area is covering by the placenta. So this condition is called as the partial placenta previa. And here very small, okay, very small area is only 2 centimeter of the uh, internal os is covered, that is called as the marginal placenta previa. And rather here it is not covering the internal os, but it is present to the lower segment of the uterus, so it is called as the low lying placenta previa. So what are the conditions and what are the main causes of the placenta previa here? So at the placenta previa, the main cause, the exact cause is not known, but we can think, and we have some points that it may be due to the upper uterus endometrium not well vascularized. If the upper area, that is the fundal area of the uterus, is not well vascularized, so there is a less chance of formation of the placenta to the upper area. Or it may be damage from the previous cesarean section, or the upper area of the fundus is having some sort of scar due to some previous cesarean section, so the placenta will not attach to the upper segment. And it may be due to some abortion, some uterine surgery, multiple pregnancies, okay, smoking, and some sort of intrauterine fibroids. And if the maternal age is more than 35, and if the placenta larger than the normal size, then definitely the placenta start to move down, okay, some alcoholism, and there are many conditions which causes the placenta previa. So we understand some causes, that if the upper part of the fundus is not well vascularized, if there is some scar on the fundus, if there is some uterine previous surgeries, if multiple pregnancy, abortion, placenta is larger than the normal, smoking, intrauterine fibroids, alcoholism, and maternal age more than 35. So these are the causes or risk factors of having the placenta previa. So what are the complications which commonly occur? So as we see that if the placenta is near the internal os and the fetus is lying vertically or in vertex position, so with the passage of time the fetus start to grow up. So once the fetus start to grow up, it suppress the placenta near the head. So the cephalic part of the fetus presses the placenta, So once the pressure exerted on the placenta, there may be a rupture of the arteries, so there may be bleeding from the placenta. And if the placenta start to bleed, if the placenta is insufficiency occur and the placenta is not well providing blood supply to the fetus, then there is a chance of formation of fetal hypoxia and fetal heart decelerations and fetal intrauterine growth abnormalities, and it also lead to preterm delivery. So these are the complications. So what are the sign and symptoms of the placenta previa? So as we have the previa word here, okay, Previa. So I made in the morning for that. So P mean painless bright red bleeding. So painless bright red bleeding is a sign of one of the sign of the placenta previa, and R for a relaxed soft uterus, non-tender. Why the uterus is soft? Because definitely the placenta is not attached to the fundal part. Okay, the placenta is at the lower end of the uterus. So the upper part of the uterus, when we palpate that, we can feel that the uterus is relaxed and smooth. And E for episodes of bleeding, V for visible bleeding, I for intercourse post bleeding. When the mom she go undergo intercourse and during sexual after sex after having sex, there will be bleeding from the vagina. That is one of the sign of the placenta previa. And A for abnormal fetal position. So P for painless bright red bleeding, R for relaxed smooth uterus, non-tenderness, E for episodes of bleeding, V for visible bleeding, I for intercourse post bleeding, and A for abnormal fetal position. So what are the treatment of this placenta previa? So normally the placenta previa, sometimes it move by its on and it's go toward the upper side of the fetus when the baby starts to increase in size. When the uterus size increases, definitely then the placenta also go up. But if not, then we need to take some measurements. We need to give corticosteroids for the fetal lung growth. We recommend bed rest for the mom, and we should do some blood product intravenous fluids. Okay, if the bleeding is severe and if the condition is so severe that the fetus having some severe fetal hypoxia, or there is maternal hypotension due to excessive bleeding, in that condition we need to do cesarean section. So this is somewhat about the placenta previa.